It's all about taking control of your life. And that's what the West Virginia Breast and Cervical Cancer Screening Program and Wise Woman Program are all about. They're making quite an impact in one rural area of the state. To tell us more about this is Ruthie Watts, a nurse and health information specialist with the program's outreach staff. Ruthie, thanks for being here.
Thanks for having me.
Tell us about what areas of the state that you cover.
There are 4 of us that cover the entire 55 counties of the state, but I work in the eastern region and I cover 14 counties on that part.
So those 14 counties, your job is to really focus on outreach efforts for women's health.
Yes, yes.
Now, in a rural area, we always worry about how do we actually get the message out when, you know, there could be more challenges, but just because it's rural in nature. Tell us what you do that's sort of different and really special in terms of how we reach out to people who live in rural areas of West Virginia.
Okay. I educate and promote the breast and cervical cancer screening program and the Wise Woman program at the local level, and that may be attending health fairs, walks for women to take a step against breast cancer, speaking to groups, churches, organizations, maybe even speaking to a woman one-on-one about her health and getting screening, early detection, and also we raise awareness. I do in the Eastern Panhandle there. During October, Breast Cancer Awareness Month, as well as Cervical Cancer Month, which is January, and February is Heart Health Month, but actually raising awareness all year long to promote these services.
Well, and that is important, getting the message out for early screening, obviously. And we talked a little bit about in our earlier segments about the things that women can do to improve their health and to, you know, really focus on this early detection. What types of lifestyle changes, you talked a little bit about, you know, walking with heart health, but what are some other things that you promote or that are promoted through both the Wise Woman as well as the Breast and Cervical Cancer Screening Program?
We focus on incorporating more fruits and vegetables into the diet, increase physical activity, to live a smoke-free life, and to maintain a healthy goal, weight or else get to a healthy goal. And one way of doing this is the TOPS program, which Wise Woman will pay for a member, or a lady that's a part of the Wise Woman program to pay for her annual membership into TOPS.
Well, tell us about TOPS, because I know everyone's going to ask, you know, when we talk about TOPS, because we use lots of initials in what we do. It's TOPS. Tell us what that stands for and really what that program is all about.
Okay, TOPS is Take Off Pounds Sensibly, and we focus on healthy living, changing our lifestyles. It is a nice chapters across the world. We meet each week and have a private weigh-in, and we reach a goal weight between whatever the doctor and the TOPS member has chosen to be the woman's, or even men can be a part of this, but she reaches her, and there's all kinds of support there, and we help each other encourage lifestyle changes. Portion control, we don't usually use the word diet, but it's lifestyle changes.
Now, I know you live in Grant County, and I think we can say that Grant County is now going to be well known because of their TOPS program.
Yes.
And tell us how that happened.
Our health department there is the Wise Woman provider, and it was the only Wise Woman provider that did not have a TOPS in its area so they could refer the woman to. And I agreed to start the TOPS, and I got on social media asking if people would be interested if I would start a TOPS program there. And I've got a lot of response. The first night we met, there was 10 of us, and now we've grown to 35 in member. A total of probably about 20 of us have taken off 300 pounds a little over a year.
Wow, congratulations.
Yes,
that's wonderful.
Very successful, and it's a support and facing those scales every week.
So that's the program in Grant County, but the TOPS is a national program, and obviously the program is pretty consistent in terms of what it recommends. What do you feel is one of the most important aspects of that program? Because I know a lot of people go on diets or they try weight loss, and it's really difficult. It's not easy, and as we get older, our metabolism slows down.
Absolutely.
What do you think makes TOPS successful?
It's the lifestyle change, and not really dieting, but changing your lifestyle, your habits, learning to control your portion sizes, living a healthier life, increasing our physical activity, and supporting each other.
And I think supporting each other is important. Someone to talk about when you have challenges and, wow, I didn't get out and walk today, but okay, your friend there at the program says, okay, we'll get out and walk. Let's do it tomorrow. I think that does help. Would you agree?
Yes, it does. It really does. The support is awesome.
Now, I know that we don't have a Wise Woman provider in every county necessarily, but we do have some throughout the state. So how does that work? If someone would be interested in getting involved with Wise Woman or even with TOPS and how they could coordinate those two, what do you suggest a person does? After hearing our program, hopefully we'll generate some interest.
Absolutely. I believe there's 13 Wise Women providers across the state, but now there's a hub that if a woman age 30 to 64 and she's a participant in BCCSP but wants to participate in Wise Woman, she can go to a provider that does provide that service, and they will refer her to TOPS if her goal is to lose weight, and they will pay for her annual fee to join.
Now, is there a way that the work that's done in TOPS and the goal weight and the things that the ladies may do in that program, does that connected back to the breast and cervical cancer screening program or the Wise Woman program or their providers, so that there's a coordination of the care that's being provided?
Absolutely. We work close together and provide each other information that's needed, for the
So we're talking about sort of a holistic way.
Oh, yes, absolutely.
Of doing things. Now, I know you work at the county, a lot of the work on the one program was through the county health departments, which we really appreciate that county health department being involved. But I understand there's a wide range of different types of providers that do our breast and cervical cancer screening program, our Wise Woman program, and then have TOPS chapters. Can you talk a little bit about the variety of different types of providers across our state that are involved with this program?
The 13 Wise Women providers are working very close to the TOPS, with TOPS, to refer the ladies to TOPS. And if there's a woman that wants to see if she can benefit from TOPS, she can, or find a provider close to her, she can visit www.tops.org and find a provider close to her.
Well, we have lots of providers out there doing lots of great things. Thank you for what you do, and thank you for being here on the show today.
Thank you very much. Thank you.
That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling, Cabinet Secretary for the West Virginia Department of Health and Human Resources. Thank you for watching The State of Health here on the Library Television Network.